Thank you, sir. Along with us, we have Dr. Sanjay Bedi. Sir is Professor of Pathology, basically. And for IT sector, I can say my guru. And means to bring me in the IT sector, Dr. Sanjay Bedi has played a vital role. And now the topic what he is going to deliver is prompt engineering. કે આપણને એવું બધું કહેવામાં આવે છે કે ભાઈ ચેટ જીપીટી છે કે પછી જેમિની છે, પરપ્લેક્સિટી છે, ઘણી બધી એપ છે, પણ એપ પાસે કામ કેમ લેવું? માણસો તો આપણી પાસે હોય, એની પાસે કામ લેતા તો આપણને આવડવું જોઈએ ને. સો ધેટ વી આર ગોઈંગ ટુ લર્ન ફ્રોમ ડોક્ટર સંજય બેદી સર. સર, ઓવર ટુ યુ. સર, આપ મ્યુટ હો.
Thank you, Dr. Chennai, for giving me this opportunity. And I'm very thankful to my previous speaker, Bhruguraj Trivedi, because he has laid the foundation for my session also. And we believe that India is going to be the hospital for the whole planet by 2047. And together these efforts are going on. I mean, all these activities are going on in unison. So you all know, before I start, I request the entire audience to go to menti.com and put in the code and then place the code 35469882. Mine is a small session, but we will use it later on. So,
કોડ હું ફરીવાર બોલું છું, 35469882. menti.com. menti.com. We'll take.
So, what is artificial intelligence? I mean, these days we are all using this, and explaining this, if we explain this to a small child, that is, it can answer many questions, and it can help doctors. And it has read millions of books and stories, and everything is stored at one place. But it cannot answer till you ask this tool, whether it is the Chat GPT or Perplexity or Claude or DeepSeek. I mean, you have to ask the question very nicely. Without this, it won't be able to give you the answer properly. So, be specific and also give example to this tool that, okay, and at the end, give it some more detail. If you ask a wrong question, it will not be able to give you a proper answer. And why do doctors, they need prompt engineering? Because our brain cannot keep everything all the time. The artificial intelligence is a helpful assistant, and asking the tool clear questions matters. And if we ask a wrong question, it will give a wrong answer. And this will help our patient care much better. So, I will just show you, because I have got only 20 minutes. So, I will show you some tools. There are a lot of tools, and I have given Dr. Chinmay a cheat sheet of over 100 prompts, but common prompts which I can give you right now with demonstration. There is PICO prompting. P stands for patient or problem. Who is the patient? What is the condition? The intervention, what treatment or diagnostic test you are considering. And comparison, what is the alternative to compare against? An outcome, do you hope to accomplish or measure? So this is a PICO. If you tell the tool make a PICO prompt, it will understand automatically. So now we go to ChatGPT. Okay, I am
Yes, sir. Right now, screen is not shared.
just a moment. I am sharing. So can you see my screen?
Sir, it's coming. Yes.
I am
Yes.
I am on Perplexity.
Yes, sir.
Using Pico prompt, generate 3 evidence-based treatment evidence options for hypertension in early patients with chronic kidney disease, comparing their effectiveness in preventing cardiovascular events while minimizing adverse effects.
Sir.
So it
Sir, can you
automatically understands that there is a Pico prompt.
sir, can you zoom little bit your screen?
Zoom is okay. I can't.
Okay, sir.
Uh,
No problem, sir. Continue.
okay. So it is thinking. It has created a Pico prompt treatment options for hypertension in elderly patients with chronic kidney disease. Population, intervention, comparison, outcome. It has taken all the 4 parameters and then it has given the effectiveness, adverse effect profile, and various calcium channel blockers, adverse effect summary table, key points, and additional questions also, which I can ask. This is the Pico prompt. If you tell any large language model that I want to apply the Pico prompt, it will automatically understand and then you give the patient's history. There are some prompts which are called the uh, single line prompts, but this is an advanced prompt. Okay, I share once again back to the PPT.
सर स्क्रीन चेंज नहीं हुआ है.
Whatever. Next is chain of thought prompting, that is thinking step by step. If you say this tool, any tool that create a chain of thought prompting, it will understand automatically. Like ask the artificial intelligence to reason and phrases like think step by step, then show reasoning. Explain the diagnosis process for chest pain, beginning with initial presentation and working through the differential diagnosis step by step. And then you can modify that, show, not to give incomplete answers, and the physician will explain how this is how physicians think when they deal with their patient. So we will now place this in a large language model. This time I'm using ChatGPT. Last time I was using Perplexity. So I just press the button, think step by step to develop a differential diagnosis for a 45-year-old female presenting with acute abdominal pain in the right lower quadrant, fever 35 degrees centigrade, leukocytosis. Explain your reasoning at each step. So it is giving localize the first it says whatever we have asked, then systemic clinical reasoning, history, presenting features, anatomical localization, pattern recognition, consideration of common versus serious causes, and focused investigations. Step 1, localize the pain, regional anatomy, appendix, ileum. So it will direct it to a particular region. Attention to GI, gynecological or urinary symptoms in that area. Then categorize by system-based causes. Gastrointestinal causes, gynecological causes, urinary tract causes, lymphatic causes, vascular causes. The entire differential diagnosis is available. Now apply clinical clues to narrow differential. Fever, 38.5 and leukocytosis suggest infection or inflammation. Localized pain suggests peritoneal irritation. No mention of diarrhea, hematuria, or menstrual irregularities. This makes appendicitis the most likely cause, but gynecological causes must be excluded in females. Rule out emergencies first. Appendicitis, risk of perforation, ectopic pregnancy, ovarian. So just put in the patient's history and ask it to give you a chain of thought prompting. And automatically it will give you the tool, all these. Then plan focus investigation. Urine pregnancy test, pelvic ultrasound, abdominal ultrasound, CBC, urine analysis, CT abdomen. And then and the entire appendicitis, ovarian torsion, ruptured ovarian cyst, pelvic inflammatory disease, ectopic pregnancy, Crohn's disease. So it has provided it just with the patient's history, and then asked it to give you a step by step prompt, and automatically it has done the entire workout as a doctor thinks. And then the most probable diagnosis is acute appendicitis, and urine pregnancy. Immediate next steps: urine pregnancy test, transvaginal ultrasound, CBC, CRP. So this does not replace doctors, but it is a very important tool. The responsibility remains with the doctor, but it has provided you with a very good thought process. So we go back to the presentation. So this chain of thought, this demonstration of chain of thought prompting we just saw. For different situations, there are different prompts. Then there is a tree of thought prompting. This is multiple prompts. Explore multiple options, generate multiple hypotheses, and evaluate different prompts. If you tell the ChatGPT or Perplexity the applied tree of thought prompting, it will automatically understand and then compare and conclude. The tree of thought prompting is a very important way of especially when we are not sure of the diagnosis. So we go back to the ChatGPT. So this is the tool. Generate a comprehensive decision tree for managing acute stroke symptoms, exploring different branches based on on time since onset, patient characteristics, and available resources. For each decision points, provide the clinical rationale. So we have a patient of stroke, and we want to give it a tree of thought. See, the moment we said decision tree, it will understand. Just one word, there is a language of all large language models which we have to understand because they have been taught according to this, that if this is what has been asked, and every word matters because every word is a token, and 6 billion computers, decisions, they are applied when we ask a prompt. So acute stroke management decision tree. Initial presentation, patient presents with acute neurological symptoms, hemiparesis, aphasia, facial droop. Action, perform rapid stroke screening. Decision point 1, time since symptom and onset, 4.5 hours, more than 4.5 to 24 hours. Then rationale of each step. Then immediate assessments and stabilization, action, airway, breathing, circulation, image findings. Decision point 2, is it ischemic or hemorrhagic? Hemorrhagic stroke, then do this, BP control. Rationale, early hematoma expansion predicts poor outcomes, surgical decompression. Then reperfusion eligibility, IV thrombolysis. Decision point 3, time more less than 4 hours. Yes, no. Then TPA exclusion criteria, active bleeding, major surgery, platelets less than 1 lakh. Then endovascular therapy, decision point 4, blood pressure management, special populations, elderly, pregnant women, anticoagulants, post-acute care pathway, if not, whether eligible, if perfusion therapy given, if not eligible, secondary prevention, and then ultimately it gives us a simplified decision tree, hemorrhagic or ischemic. And this can also, it can provide it as a flow chart. Because of paucity of time, I am not creating flow charts, but all that is possible. And the more detail you give it in the initial prompt, the more focus it will be towards your patient. So we go to we will take only 3. Next is co-star prompting. Co-star means context, objective, situation, task, action, results. So co-star prompting helps us to again provide a comprehensive framework of our patient. We just give it the patient's background, relevant history, purpose of intervention, the situation, the task-specific actions needed or undertaken, the action interventions performed, and treatment provided, and the result, outcome of interventions and next steps. So let's go to again to the large language model and so now in the beginning of the prompt I say using the co-star framework. The moment I say co-star, it understands. Create a comprehensive post-operative care log for a 72-year-old patient following a total knee replacement surgery, including pain management approach, mobility progression, and discharge planning. I just give it the prompt. Post-op framework for post-operative care log, total knee replacement, the context, the detail of the patient, observations, vital stable, mild tachycardia, pain, strategy, tactics, implementation, day 1, day 2, day 3, day 4, the action, pain assessment, daily wound monitoring, mobility monitoring, blood glucose monitoring, psychological status, reflection, outcomes, discharge plan, and this way it will provide us, and pain management control, the drugs, paracetamol, tramadol, mobility milestones tracker, everything it has provided us. So just because I know the prompt and I just provide it with the patient's history, it is an add-on to my mind. It will never replace the doctor, but it will provide us with an add-on. So this was the last prompt because I cannot take more prompt. But I can say that we undergo, we conduct about a month of training in prompt engineering in which, and I have given Dr. Chinmay a cheat sheet in which the list of prompts is there and which you can take from him. So how prompt engineering helps? Basically, it provides a clinical tool by which our documentation can become accurate and the treatment planning also becomes accurate. The lot of medical errors they can decrease, and also we can create, if we ask it to give something for patient education for the same report, for the same pathology report or any other report, it will recreate according to the patient's and in patient's own language. So, in conclusion, the artificial intelligence and prompt engineering, it empowers the healthcare professionals, and it is going to become the most essential skill for healthcare professionals who want to leverage the artificial intelligence effectively in their practice, and it will provide usefulness, safety, relevance, and enhance the decision support while maintaining the human expertise. And it will create opportunities for more personalized patient care and reduce the administrative burden through better artificial intelligence assistance in record keeping. So, now we have a small question answer session. मेंटी में है. I will give you 30 seconds, so you can all join.
લખેલો છે 35469882 35469882 જો ઉપર લખેલો છે અહીંયા આગળ 35469882. Yes, everybody has joined.
So I can see that many of you have already joined. So this will be a question on session on prompt engineering. How many of you think that India will become the hospital for the world, for whole planet by 2047? Yes, no, maybe. Answer on your mobile screen. Okay. 2 people have responded. Fourteen have responded. See, this is the beauty of technology. I can ask you from anywhere in the world, and your mobile phone becomes a tool for just like Kaun Banega Crorepati.
Next, sir.
Please respond. So you can see it is a very enlightened audience. The yes is leading, no is behind, and maybe is again the maximum number of people are saying yes. So when we think positive, we achieve it. And India will definitely become the hospital for the whole planet. Just imagine the ABHA IDs from my previous speaker and the hospital record for all the entire population, and even the people coming from different countries. They can be, their post of care can be given wherever they are in the world. So the next one, what comes to your mind when you think of prompt engineering in healthcare? Please respond on your mobile phones. Yes, we have some answers. 5 answers. Ten answers are there. Yes. Prompt engineering is the process of crafting precise and effective instructions for AI, especially LLMs, to generate accurate and contextual relevant outputs. Yes. The fear of losing job, very good idea. Doctor 24 by 7. How can we integrate engineering in medical education? So, a number of answers are there, and almost all of them are correct. Which area do you think benefits the most from prompt engineering in medical sciences? Clinical decision support, patient communication, research and development, medical training, data analysis.
તમને અત્યારે એવું દેખાતું હશે કે સારું શું છે, ભજીયા છે કે પૂરી છે કે સુગંધ આવી ગઈ છે. ગ્રાફ ઊંચો નીચો થાય છે પેટમાં એમ.
Yes, beautiful. Data analysis is winning, followed by research development and clinical support, followed by patient communication and medical training. 21 people have responded out of 40 who have joined. We can give you 15 seconds more to respond. Rank the following benefits of prompt engineering in medical sciences from most to least. First, improves patient outcomes, enhanced data accuracy, increased efficiency in workflows, better communication among professionals, facilitated, okay. Improved patient outcomes is winning, followed by enhanced data accuracy. Enhanced data accuracy is now winning. Increased efficiency in workflows, better communication amongst professionals.
Sir, sir, we need to.
Okay.
Yeah, we need to complete fast, sir.
Okay. This is the last question.
Okay, sir.
What challenges do you foresee in implementing prompt engineering in your practice? This is the last question. Adaptation and acceptance. Training, guidance, technical illiteracy, adaptation, AI knowledge, poorly structured prompts make it difficult to find answers, adaptation, lack of support from stakeholders, technical skills, and adaptation. Implementing prompt engineering in my practice presents several notable challenges. First, keeping up with the rapidly evolving field is difficult. Technical support, digital health record linkage adaptation. This is very simple. It is something known as agents which can do it. A tool, an IT tool. So basically, these are the uh, uh, challenges which you all foresee in implementing. Yes, these are all very much the challenges, and we will be able to overcome them once more such workshops, etc., can be done. So this was the end, and
Thank you
I
very
mean,
much,
I
sir.
was given only. I mean, we can have a day, 1 day, 2 day, 3 day workshops only on prompt engineering. It's a very uh, interesting field.
Yes, sir.
So
Thank you very much, sir. In short notice, you have taken live session before we, this we thought of having a video session. But thank you very much,
yes,
sir. And as I said to Bhrugura Trivedi